every time that they walk in through those doors, there is a sense of being here that belongs to every one of us.
Kelly Rowe is the Executive Director of Health Services for the Confederated Tribes of Grand Ronde, and she's standing in the brand new health and wellness clinic on the reservation, about an hour and a half southwest of Portland. The clinic is set to hold its grand opening in just a few days, but the tribe invited KGW to look at some of the new technology that makes the health center unique. Ryan Webb is the engineering and planning manager for the Grand Ronde Tribes.
This building was designed and constructed to really help solve some issues that we experienced during the pandemic.
They already had one clinic, and for years, it served the community well. But during the pandemic, it became difficult to provide health services and COVID testing while keeping everyone safe. The new health center has energy-efficient lighting, solar panels, and lots of windows to let in natural light. But perhaps the most important new feature is the heating and ventilation system. It's divided up into zones that can help in quarantine situations.
During a potential pandemic and airborne disease situation, we can actually shut it down and bring 100% outside air into the building.
The Grand Ronde Tribes partnered with Energy Trust of Oregon to help choose and fund the environmental upgrades.
The tribe is very committed to really being the stewards of the land like they always have been.
Cheryl Kennedy, chairwoman of the tribes, has been working on public health at Grand Ronde since the early 1980s. But the driving force behind things like the new health center took shape well before then. In the 1850s, the tribes were forced off their ancestral lands in exchange for federal recognition. And it stayed that way for nearly 100 years. But in 1954, the federal government revoked that recognition through a process called termination.
That was very difficult for most of the families because the land was taken. Termination meant they came in, they stripped you of all the land that you had, any service that was provided to you, and they said, okay, you're free, go.
For decades, that meant getting resources was difficult, especially when it came to medical needs.
The clinic that serviced Grand Ronde at that time was located in Salem. So services were non-existent here, and so if people wanted health care, they had to figure out how to travel to get there.
Kennedy joined tribal leadership right around the time they regained federal recognition in 1983.
My job was to develop all the health and human services for the tribe.
But those in-between decades, when the tribes weren't recognized, taught her that if they needed something, they would likely have to do it themselves.
So this is so important, laying the foundation for this where our members can come and we no longer have to be in fear that we're the orphan child, that we're not going to receive the services that other Americans and Oregonians receive.
There are nods to tribal culture throughout the clinic.
When you come into the community room, you're going to see the big round window. It represents a couple of things. One is the medicine wheel, so it's a representation of the medicine wheel. It also mimics our plank house. It's the round doorway into the plank house.
The wood siding, salvaged from tribal lands that burned in the 2020 wildfires, holds significance.
We try to use everything we could from the tribe, source within, use things that were important to us as a tribe.
And there's a demonstration kitchen with upgraded audio and visual tech, so tribal members can prepare traditional foods while live streaming to folks all over the world.
And it's not just a focus on Western medicine, but really how nutritional health or cultural practice can help heal people as well.
And just outside, there's a fish pit for traditional preparation of salmon.
We have the salmon stamped outside. That's to show it's not just our first food, but it's our relationship to the water. It's our relationship to the fish. It's how important it is for us to be honoring that. Every time we walk out on that patio, we're going to see that, and it's like, yes, we have that. That's part of us.
Cale Williams, KGW News.